I have a diagram here. This is the best way to understand what stem cells do today and the distinguishing factors between them. If you look here, this is a stem cell diagram. The big controversy today revolves around embryonic stem cells or fetal tissue stem cells versus umbilical cord stem cells. What we do today is solely with the umbilical cord stem cells. However, there's a lot of research and a lot of controversy going on with the fetal stem cells or embryonic stem cells. For example, if you look here at the very beginning, embryonic stem cells are called totipotent stem cells. That means that these cells, the initial cells of the body, can now divide and multiply into any type of cell. So for example, an embryonic stem cell has the capability of dividing into blood cells, into lung and liver cells, and also into bone and heart cells, and vice versa down the line. Lo and behold, umbilical cord stem cells are one generation below, a little further developed than embryonic. Therefore, they're called multipotent stem cells. Here's the big distinguishing issue, is embryonic stem cells have the ability to recreate themselves, therefore clone themselves. There's a lot of moral and ethical issues to deal with regarding cloning. In addition, embryonic stem cells currently come from fetal tissue or from the demise of fetal tissue. Therefore, there are a lot of moral and ethical dilemmas. That's why we've gotten into umbilical cord blood cells, which are one step below. These stem cells here, that are called hemopoietic cells, do not allow us to go backward and recreate themselves. What they are the precursor cells for the blood. Thus, any stem cell that's an umbilical cord stem cell has the ability to divide into disorders or into cells that allow disorders to be cured that derive from the blood. Leukemias, myelodysplastic syndrome, stem cell disorders, red blood cell disorders, anything that deals with the blood, including bone marrow transplants. Unfortunately, the embryonic stem cells, which would also have this capability, have a lot of inherent problems associated with them, and thus we've chosen to use the umbilical cord stem cell route. If you look at this diagram, the biggest key here is that umbilical cord stem cells, since they don't have the ability to go backwards, all of a sudden in the past few years we've gotten the ability to take umbilical cord stem cells and go laterally. Thus, if we can take a cord blood stem cell and develop a liver cell, a lung cell, a bone cell, or a heart cell, all of which have already been done today, then there would be no need to use these embryonic stem cells in the future. We would then remove the controversy in using those embryonic stem cells. Going back to these umbilical cord stem cells, how are they derived? Where do we get them from? When a child is born, parent is pregnant, woman is pregnant, we then take those stem cells at delivery. There's one time in life that we can get these cells. Baby is born and delivered, the cord is clamped. We then take a special kit and we put a needle into the umbilical cord and withdraw the blood. Now, at the time that this occurs, the cord has been cut, the baby has been taken to the neonatologist, and we take the blood out of the umbilical cord. There's no pain involved, there's no danger to mother, there's no danger to baby. However, when we get these cells, we can then take them in a lab and expand them and use them to transplant back either into that child, a sibling of the same two parents, or into one of those parents. These stem cells now have been used for a tremendous amount of diseases. For example, we've cured over 76 diseases today. They include things such as leukemia, myelodysplastic syndrome, anemia, and recently sickle cell disease. As I said, as we are now branching into the lung and liver, moving horizontally on this chart, and into the bone cells and heart cells, we've literally been able to make osteoclasts or osteoblasts, new blood cells that are bone precursors, and regenerate the bone using these cells. In other locations in the world, they've already created myocardial cells or heart cells, as well as lung cells, and the first transplant into a cystic fibrosis patient has already been done. So you can see that if you look at this chart, there's no need to really go backwards and start with the embryonic stem cells and deal with all the inherent issues, moral and ethically, that would go along with those. But we can now use these umbilical cord stem cells and do the same amount of benefit with really minimal risk. The other thing I'd like to point out is on umbilical cord stem cells here, that these are multipotent stem cells. Now these stem cells are able to be used today to treat over 76 diseases. Unfortunately, embryonic stem cells, which maybe have more potential in the future, unfortunately have never been used to cure anything. The interesting thing is umbilical cord blood has another purpose that people don't even realize. Sometimes umbilical cord blood can be used directly to treat that disorder, a specific disorder. At other times, umbilical cord blood may provide the benefit of providing a bone marrow transplant duplicate. Today, a child or an adult that requires a bone marrow transplant, in order to get a transplant to cure a disease that they may have, they have to go through a bone marrow donor registry. In the United States, a bone marrow donor registry, they have approximately 3 out of 10 chance of finding a suitable donor, and that is if they're non-minority. It's significantly less if they're a minority by any chance. Therefore, today we have cord blood that can do something very similar, yet without some of the complications and with a much higher rate of success. If a family stores cord blood for their child, and one person in that family, either that child, a sibling, or one of those parents, develops a disorder that isn't directly cured by umbilical cord blood. However, there's a current treatment for that disorder, such as chemotherapy, radiation, yet they would need a bone marrow transplant in order to be able to take the treatment. Today what we have is the ability to use that umbilical cord blood as their bone marrow transplant. So, although the cord blood doesn't actually treat the disorder, it sure allows them to have the treatment and then use the cord blood as a bone marrow substitute so that they can have the treatment successfully. The benefit of using cord blood over a bone marrow transplant is significant. One is if you are the parent or sibling of the child that donated the cord blood, or even the child that donated the cord blood, you would have a much higher success rate of being a match with this cord blood, anywhere from 6 to 9 out of 10 versus less than 3 out of 10 chance of a match. Therefore, now you have a suitable donor in blood that is useful for a bone marrow transplant. This would allow the person being treated to use this bone marrow transplant and have their successful treatment that's already available. Cord blood has less antibodies in the blood because it never crossed the placenta. Therefore, this blood is untainted. These cells don't have antibodies. Therefore, the amount of rejection that you would get by transplanting this blood into another person is significantly less than had you taken blood from a human being or bone marrow from a human being that has already been alive outside of the womb. These antibodies specifically target rejection, and that's where all the medications come in that are very expensive and require a lot of monitoring. So today, do umbilical cord blood stem cells treat every disorder? And the answer is obviously no. There's a list of disorders that we've already been successful treating, and there's a bunch on the horizon that research is going through. The large ones are Parkinson's disease, which is what my father has and why I went into this, versus Alzheimer's disorder, or Alzheimer's disease, which is ravaging the country as the population gets older. So, the goal here is to get quality sample and have your doctor, your healthcare provider know what they're doing prior to going into the delivery room. We aim to educate. That is our goal, to teach and educate those medical professionals so that they can then be prepared to take this kit and the contents within inside when you go into delivery, and then lo and behold, collect a significant sample